Hello everyone, thank you all for coming tonight. My name is Chad Rao. Tonight I'll be discussing Parkinson's disease. We're going to cover what this disease is, the causes, the signs and symptoms, the risk factors, the complications, and finally the treatments. In our community we have several patients that have Parkinson's disease that we transport, and I hope that after tonight we'll all have a better understanding of this disease process and we'll be able to better treat these types of patients. I have studied material covering this disease and will be citing several different resources on the information I've gathered. In an interview with Diane Sawyer had with Michael J. Fox, he stated that due to his uncontrollable muscle movements, they struggle doing day-to-day activities such as brushing his teeth. Based on a study found in my Anatomy and Physiology book, there's approximately 1 million Americans that already have been diagnosed with this disease, and there will be approximately 60,000 more cases each year. All of these patients, all of these people that have been diagnosed at one point will have, one point or another, will go through the same problems that Michael J. Fox has. Now let's begin with what this disease is and the causes. Parkinson's disease is a progressive disorder of the nervous system that affects your movements. It develops gradually and often just starts as a tremor in one hand. In Parkinson's disease, certain nerve cells in the brain gradually break down, deteriorate, and die. Many of the symptoms are due to loss of neurons that produce dopamine in the brain. When dopamine levels decrease, it causes abnormal brain activity. Another cause that researchers have found is specific genetic mutations, which are uncommon except in patients affected by Parkinson's disease. Also, another possible cause is exposure to certain toxins and environmental factors. They may increase the risk, but it is relatively small. There needs to be more research done to find out the factors that lead to Parkinson's disease that have not been done yet. So now that we have that figured out, let's move on to the signs and symptoms. There are 7 signs and symptoms that I will cover tonight. First is going to be the obvious tremors and shaking. This usually begins in your arms and starts with your hands and fingers. The shaking will continue while the patient is asleep or at rest. The second thing is going to be slower movement. Over time, Parkinson's disease is going to cause you to walk slow and move a lot slower. Your steps are going to become shorter, as well as you may drag your feet when you walk. The third thing is going to be rigid muscles, and this can occur anywhere in the body. Fourth is going to be impaired posture and balance. You will have a stooped appearance and balancing problems. Fifth is you're going to lose your automatic movements. You're going to have the decreased ability to perform unconscious movements such as blinking, smiling, or just swinging your arms when you walk. The sixth thing is going to be speech changes. You'll begin speaking more softly, quieter, slur your speech, or hesitate before you start talking. Also, you may become more monotone when talking. Seventh and lastly is going to be writing changes. Your writing is going to become more smaller, and it's going to be more difficult for you to do. As you can see, there are several signs and symptoms of Parkinson's disease. So now let's move on to the risk factors. One of the main risk factors is age. Young adults rarely experience Parkinson's disease, and it normally begins in middle to late life. And the risk increases with age. The average age of development is going to be around 60 years old. The next risk factor is going to be heredity. Having a close relative with Parkinson's disease increases the chances of developing the disease. This risk is going to be very small unless you have several family members that have Parkinson's disease. Thirdly is that men are much more likely to develop Parkinson's disease than women. Out of the patients that we have in our community, there's only one female that I know of that has Parkinson's. In a journal from the Oxford Parkinson's Disease Center, it was found that in men, Parkinson's disease is more a symmetrical upper body movement, whereas in women, it's going to be more of a posture type symptom. Fourth is going to be exposure to toxins. Researchers found out that ongoing exposure to certain herbicides and pesticides will increase the risk, but it's still going to be very slightly. Now we're going to talk about the complications of Parkinson's disease. Based on an article in the U.S. News newspaper, the biggest complication with Parkinson's is disease-related depression. Some of the researchers are now saying that depression is actually a precursor to Parkinson's disease, and it's going to be one of the biggest side effects to treat. Secondly is thinking difficulties. Parkinson's disease patients may have dementia or other thinking disorders. but this is normally going to occur in the later stages of Parkinson's disease. Thirdly, they develop swallowing problems. Typically, saliva is going to accumulate in the mouth, and this is going to cause them to drool due to them having slower responses on swallowing. Fourth is going to be sleeping disorders. Of course, they're going to have the tremors and the shaking that they can't control, and this is going to typically keep them up at night. And this is going to be cured with aid of sleep medicine. Fifth is going to be bladder problems. Patients will begin losing control of their bladder as well as having problems urinating. Lastly is going to be constipation. Due to the slower digestive tract, many patients with Parkinson's are going to develop constipation. Now that we have covered the complications, let's cover the treatments for Parkinson's disease. Unfortunately, there's no cure for Parkinson's disease, but with medications, they can help control your symptoms. Medication can help manage many of the problems and the side effects of Parkinson's disease. One of the bad things is, when I covered what Parkinson's disease is, there's a lack of dopamine in the brain that causes your abnormal movements, but you can't be given that dopamine directly because it won't enter the brain. Another bad thing with Parkinson's is that the medications that they give you to treat all the side effects, they're going to slow down in their reaction with your body to be able to manage those symptoms and side effects. There's one surgery currently being done to try and help the tremors, and that's called deep brain stimulation. This is where they're going to go in your brain, put electrodes on a specific area of the brain. Small electrical pulses are going to be sent to the brain, and this stimulates an area of the brain to help control the tremors. All medications and treatments don't stop the progression of the disease. They just help aid in living with this disease. Now we'll wrap everything up. In conclusion, I hope you all have gained a little more knowledge on Parkinson's disease. The information I gathered for tonight was summarized from the Mayo Clinic's detailed information on Parkinson's disease. Tonight we covered what Parkinson's disease is, the causes, the signs and symptoms, the risk factors, the side effects, and the treatments. I hope we'll all remember what a patient with Parkinson's disease deals with on a daily basis, so we'll be able to better treat them and transport them to the hospital. Thank you all for coming. I hope you have a good night. If you have any questions, feel free to contact me.